Hello, welcome to the Urban Harvest YouTube channel. I'd like to thank you for your interest in the topic of prenatal care and gardening. And before we begin, I would like to introduce myself. So my name is Erika and I graduated from U of H in 2019 with my bachelor's in human nutrition and foods. And I am completing my dietetic internship with Wellness Workdays Dietetic Internship fall 2021, and I am at the moment completing my community rotation with Urban Harvest, where I've learned a lot about gardening. And a fun fact about me is that I do not like cake, and this is not something that I decided to do just because, or decided on just because I'm a nutrition major. This is something that has been part of me for all of my life. There is actually a video of my mom giving me cake when I was a baby, and I started crying and trying to spit the cake out. So I'm just not a sweet tooth person, and I'm honestly kind of glad. But without further ado, let's continue with the presentation. An active pregnancy in a nutrient-filled diet is an important need for the prenatal care population. This is a time where being active and getting enough nutrients is going to be important because the first 9 months of pregnancy are the most intense period of growth and development. So nutritional status is it's within our control, and the benefits of optimal nutritional status is the most obvious during this time of life. So in this presentation we will discuss parameters of healthy weight, energy intake, as well as dietary measures, bioactive components of food, how gardening helps, and ideal nutrient recommendations. Here we see the weight gain recommendations. For a woman who's pregnant and is underweight, she will need to gain 28 to 40 pounds during pregnancy. A normal weight mother needs to gain 25 to 35 pounds. An overweight needs to gain 15 to 25 pounds. Obese mother would need to gain 11 to 20 pounds during pregnancy, and a mother expecting multiples 25 to 54 pounds. For an underweight mother, during pregnancy, they tend to retain some of that weight gained because they need it for their own needs, and this is the reason that they need to gain more weight. On the other hand, overweight or obese women can use portion of their energy for fetal growth, and they need to gain less. Now, women with higher BMIs, usually maybe a BMI of 25, since that's considered overweight, they exceed the if they exceed the recommended amount that we see here, they will have a higher risk of having a larger for gestational age, newborn, or a cesarean section delivery, as well as a postpartum weight retention. On the next slide, we will continue talk about weight gain recommendations. We just learned what happens if too much weight is gained, but what happens if not enough weight is gained? The risk is increased for infant to develop heart disease, type 2 diabetes, hypertension, and other chronic diseases later in life. Therefore, it is important to stay within that range. If you're just a few pounds under or a few pounds over, it won't affect the baby or you too much, but you want to make sure that you get and stay within those ranges as close as you can. So as you see here, our normal weight would be to gain 1 pound per month the first trimester, and then 1 pound per week the remainder of the pregnancy. Next, we will see the need for energy, because this is what's going to help us with these requirements that we've learned. In the previous slide, I mentioned what would happen if you were to gain too much weight from the recommended weight gaining amount. And if you actually don't gain enough weight, then you can also be at risk for the infant to develop heart disease, type 2 diabetes, hypertension, and other chronic diseases later in life. Therefore, it is also important to make sure that you gain the amount that is recommended. So even if you're just a few pounds under or a few pounds over, it won't be such a big deal, but you do want to stay or reach that goal or stay within that recommended weight gains that we see in the slide before. So a normal weight gain recommendation for pregnancy is 1 pound per month the first trimester, and then 1 pound per week for the remainder of the pregnancy. We just talked about energy needs, and sometimes you might feel side effects that you will not want to touch or smell food. And this is because physiological changes that occur in the body, including the digestive organs. They are more amenable to prevention than to treatment, but can often be treated with or relieved through dietary measures. Always check with your physician to confirm that these are in fact side effects from pregnancy. So of course, one of those common ones that pregnant women tend to see is nausea. So avoid an empty stomach, have small frequent meals, or snack on fruit or vegetables. Constipation is also another one, and we did mention earlier to have those foods that contain antioxidants, fiber, like fruits and vegetables, whole grains. Make sure that you keep hydrated and also keep active, which we will see on our next slide. With heartburn, just as nausea, you want to make sure that you have small, frequent meals. Make sure to eat less in one sitting, and reduce your caffeine intake if needed, 200 milligrams or less. With anemia, the most common one that we see will be the iron deficiency. So make sure that you supplement appropriately and that you eat a fruit that has high vitamin C to be able to absorb iron much more. Lastly, we have dehydration. So women, make sure that you drink plenty of fluids, especially if you're going to be exercising. All right, now gardening. What or how is gardening going to help pregnancy? Well, it's a form of exercise. You're weeding plants, you're raking, picking plants, doing different things in the garden, and this is considered exercise. So make sure that you exercise 2 to 3 times a week, and that you're working out 20 to 30 minutes each time. When it comes to the fruits and vegetables that you're growing on your own, these are going to be local and sustainably grown produce that are free of pesticides. So the bionutrients in these foods are much more active and better than store-bought fruits or vegetables. When it comes to being outside, feeling that wind, it's going to also help your mental health. So this is something that's going to be beneficial during your pregnancy as well. And it is also known for women who exercise regularly during pregnancy will reduce the risk of gestational diabetes, pregnancy-induced hypertension, low back pain, and excessive weight gain, also blood clots. And I did mention in the slide before that you want to make sure you're hydrated. So avoid dehydration by drinking plenty of fluids. Lastly, do not let cats in your garden. Cats can carry a parasite that will make you sick when pregnant because your immune system's just a little bit lower, so you can get toxoplasmosis. This is not only contracted through gardening, this is contracted through many other ways. So just make sure that you keep cats away during your pregnancy. Make sure you have a fence or any other thing that you can prevent cats from getting close to you. And then we're going to learn about nutrients that you need during your pregnancy. Here are the vital nutrients needed during pregnancy. Folate will help with organ and tissue growth. Iron, as we mentioned already, is one of the most common, and a deficiency will increase the risk of preterm delivery. It is related to low intellectual score and language, gross motor, and attention tests in affected fetus. Calcium is going to help with fetal skeletal formation and maintain maternal bone health as well. Vitamin A will help with cell differentiation. Vitamin D supports fetal growth and fetal growth and childhood bone development. Choline helps with the fetus brain growth and intellectual development, and so does omega-3. It has it is known to increase levels of intelligence, better vision, and a more mature central nervous system. So next we will talk about bioactive components of food. What are bioactive components? They are constituents in foods or dietary supplements other than the ones needed to meet basic human nutritional needs, just how we learned, and that they are responsible for a health status as well. For example, vitamins are considered essential nutrients, right? Well, bioactive ingredients are not, yet they are very beneficial during pregnancy. They include phytochemicals, which are plant chemicals. Two primary examples have been investigated for maternal and newborn health, and these are antioxidants and caffeine. We've mentioned antioxidants before already. Antioxidants protect fetal DNA from damage due to exposure of oxygen or other oxidizing chemicals in the body. Many of the beneficial effects of antioxidants are not found when antioxidants are taken by supplements. Caffeine has antioxidants and increases energy level as well as focus. Vitamin C and E play an important role of antioxidant during pregnancy. High intakes of foods that contain vitamin E are known to reduce the risk of asthma. Many foods contain antioxidants will also contain vitamin C, and it is recommended for a woman to eat 5 cups of vegetables or fruit daily during pregnancy. So next we'll learn a little bit of which foods you should be growing during pregnancy. So what are these foods that you can grow that contain vitamins, minerals, nutrients, and the bioactive components that the body will need during pregnancy? Well, foods rich in antioxidants are identified by colors: the red, orange, dark green, deep yellow, blue, purple fruits and vegetables. Those really bright pigmented ones are going to be the high antioxidant ones that your body can benefit from. There's not one specific fruit or vegetable that you need to eat. You want to make sure that you eat a variety of pigments of each fruit or vegetable because they all contain those nutrients. So deficiencies can be dangerous. For example, vitamin A can produce malformations of the fetal lungs, urinary tract, and heart. So carrots are going to contain that vitamin A. And what are something that you've heard of carrots? They're good for your eyes. So they have all these fruits and vegetables are going to contain many nutrients and benefits for your body, as well as orange and pineapples. These are high in vitamin C, and they also contain folate, which we talked about being good for your fetal growth. So next we would talk about other foods and vegetables that will be the leafy green ones, the darker ones. How are those beneficial to you? Here are more examples of some fruits and vegetables that you can grow that are the color green, blue, and purple. So I did mention vitamin A in the previous slide, and dark greens are full of vitamin A, but also vitamins C, E, and K. Also minerals, calcium, iron, folate, and fiber. So when it comes to berries, like the blueberries that we see in the picture, they're going to contain a lot of antioxidants. All berries contain antioxidants. So I fully recommend that you start your own garden and grow these vegetables and fruits that are high in nutrients that your body's going to need. If you want to make or start a garden but don't know how, then I will let you know how on the next slide. If you're new to gardening, you can visit the Urban Harvest website and learn about how they enrich the Houston community by providing community garden programming, farmers markets, gardening classes, and youth education. We do provide a link where you can sign up for gardening classes through Urban Harvest. You can find a garden near you. If you don't have any fully grown plants at the moment and you're ready to start eating those fruits and vegetables, what you can do during your pregnancy is visit a farmer's market. That walking around is going to be a form of exercise as well. So Through Urban Harvest, you can find out a location near you. Now you can search the web and find a farmer's market near you through the Urban Harvest website. And if you have SNAP benefits, you can double up on your food bucks, which allows participants to receive additional Texas-grown fruits and vegetables when they shop through participating farmers markets, farm stands, or mobile markets. These shoppers can receive a dollar for dollar match on their SNAP benefits up to $40 a day to buy even more fruits and vegetables that you know are going to be good for you during your pregnancy. So I hope that you've learned a lot through this presentation about nutrition and that you can continue to learn more about gardening through Urban Harvest. Thanks for watching.